Good morning, everyone. I am Dr. Kanika, and I did my residency from AIOC Hospital, Noida. And my paper is on a novel biodegradable polymer scaffold for in vitro growth of corneal epithelial cells. It's basically a laboratory research paper. I do not have any financial disclosures. So we know the role of corneal epithelium as a barrier and in corneal wound healing, and there are diseases that affect those which can be treated with keratoplasty and keratoprosthesis, but these procedures are not suitable to all. So tissue engineering is what we are looking towards as a future of corneal therapeutics. In tissue engineering, we extract the cell from the source, we expand it outside the body using scaffolds and growth factors, and when the desirable tissue is formed, we implant it back. So corneal epithelial cells, if want to be grown in vitro, we need scaffolds, and these scaffolds are actually engineered materials which have desirable interaction.
Can you go to full screen, doctor?
Ma'am, I can't actually go to full screen. It's not...
okay, fine. No issues. Go ahead. Go ahead.
So the aim was to prepare a biocompatible and biodegradable scaffold using polymers instead of natural sources, and which is easily prepared in laboratory and at room temperature and promotes cellular adhesion and proliferation. We used a combination of poly-D lactic acid along with a cationic polymer Utrejet. So we know as a natural scaffold, amniotic membrane is available, but then it has its own problems such as processing and infection risk. So this was an experimental and observational study. So our study comprised of various steps. Like first, we formulated polymer microparticles. Then we went on for scaffold fabrication. Then we studied the properties of the scaffold and the particles formed. We then proceeded to epithelial cell culture, and then we did cell seeding and growth studies. So this was the first step. Using double emulsional solvent evaporation technique, we formed the scaffolds, and the polymers were mixed in various ratios like 90:10 and 70:30 to just see which scaffold fits better. Secondly, we fabricated the scaffolds very easily at room temperature using just the polymer particles and fusing them with methanol, and we could form sheets of desired structure and shape. Particle and scaffold physiochemical properties like their size analysis, their surface morphology using scanning electron microscopy, charge analysis, and their porosity index was studied. We also did corneal epithelial cell culture using laboratory grown cell lines, the SIRC cell line, which is procured from rabbit cornea. Media used was Eagle's minimum essential medium, which was fortified with various growth factors. So we maintained the cell culture in proper environment in incubators, and once the sufficient cells were obtained, we then seeded them onto our scaffolds of various proportions, and we studied the growth of the cells on day 1, 3, 5, and 7. We also tried to get the primary source. So we explanted cornea from bulb C laboratory mice, which were 4 to 6 weeks old, using all the ethical guidelines. We enucleated globes and we extracted corneal buttons, including limbus, and then we separated iris tissue. Each corneal button was then used to grow further cells. So this is just the procedure, and this is the complete growth medium that we used. Following the seeding, we did the cell proliferation studies using MTT assay and live and dead staining cell assays. We also studied morphology of the seeded cells on the scaffold using scanning electron microscopy. Coming to our results, so when we studied particle morphology, we noticed that the 70:30 ratio particles, they were most heterogeneous in their size as compared to the 90:100, and the more Utrejet concentration was added, the heterogeneity increased, but the particles were stable and spherical. When we came to SEM imaging of the same, our previous findings were confirmed. Then we studied the size distribution. So the particle size was in the microparticle range, and it was an even distribution. And as the concentration of Utrejet in our polymer increased, gradually the size also decreased of the particle. When we studied the surface morphology on scanning electron microscopy, we could see the scaffolds had a porous structure, which is very good for the cell growth. We also did porosity index. The more the porosity of a scaffold, the better cell growth it imparts. So the 70:30 polymer blend seemed to have a better porosity index as compared to the plain PDLLA and 90:10 P:2E. We also did surface charge analysis. So PDLLA scaffolds have negative charge surface, and when we added Utrejet, they seem to neutralize this charge, and thus they help in attachment of the cell better. We then performed the epithelial cell culture. So our studies and growth studies revealed that of the two scaffolds we fabricated, the 70:30 scaffold showed better cell proliferation on days 1, 5, and 7 post the seeding. Our cell proliferation studies were again confirmed on scanning electron microscopy using the seeded cell scaffolds, and our previous findings were again confirmed. We also tried primary corneal culture using mice cornea. So this is the tissue explant that we perform, but because primary cell cultures are very delicate and they take a long time to seed and grow, so we could not complete that in the duration of the study. We could, however, see confluent cell culture on day 20. So to conclude, I would say that we can form stable spherical and porous microparticles using PDLLA and Utrejet combination. And out of the two combinations that we use, the 70:30 combination of PDLLA and Utrejet showed better results. The microparticles can be easily fused to form membranes at room temperature using methanol and with porous architecture and good water retention capacity. And it can also withstand handling during transplantation procedures. The addition of our polymer Utrejet enhances surface charge and thus enhances the cell attachment. Of the two scaffolds, the 70:30 scaffold showed better cellular attachment and growth profile of the corneal cell lines. These are my references, and I would like to thank my mentors.
Thank you very much, Dr. Kanika. Any question?
Kanika, very quickly, what do you think are the future, you may have covered it, what do you think are the future applications for this method?
So ma'am, because we know corneal epithelial cells derive from limbal stem cells. So in patients where limbal stem cell deficiency is a significant factor leading to their loss of vision, there we can use this explant technique and we can culture stem cells and epithelial cells in vitro, and we can implant the sheet as it is onto the patient. So the limbal stem cell deficiency patients can be benefited in future. This is what we have in mind.
Okay.